Recently, there was a publication in a leading newspaper regarding could clots in your blood affect your lungs. This is a condition called pulmonary embolism. Pulmonary embolism is a condition where thrombus or the clot which originates from anywhere in the body, most commonly from the lower limbs. People who sit, who have desk jobs, or who have long flights, or who have stationary habits where they are not moving their limbs or they're not moving at all, the blood tends to clot. And these clots do not stay back in your lower limbs, they actually travel through your veins and they enter your lungs. And once they enter your lung, they can cause immediate drop in your oxygen level. You don't even realize, but actually they are very commonly misdiagnosed because patients only start feeling breathlessness. Most of the investigations come out to be normal, so even doctors tend to miss the diagnosis at a very early stage. A very important blood test done for this is called a D-dimer. D-dimer is an investigation which has a very high negative value. That means if you have a negative D-dimer value, that means a normal D-dimer value, you almost rule out a pulmonary embolism. But a positive D-dimer could be a marker of many other problems in your body. So do not just get panicked if you have a high D-dimer. Secondly, the gold standard to diagnose a pulmonary embolism patient is by doing a contrast CT scan called the CT Pulmonary Angiography. A specific treatment which is given by a doctor, could be a cardiologist or a pulmonologist, is a blood thinner. The blood thinners can be given in the form of an injection which is given subcutaneously, or it could be also given in the oral form. There are various patients who are more prone to get clots in their blood, most commonly cancer survivors around pregnancy, and patients who are more obese or who have had recent long bone fractures, who are immobilized, or people who travel for long flights and who are having more sedentary lifestyle. They are very prone to get embolism. So this is one condition which can cause unexplained breathlessness, unexplained drop in oxygen level. Lot of times they are going unnoticed, undiagnosed, and a very common reason for people to land up in emergency without a diagnosis, and hospitals and doctors have lost the life of a patient without the embolism getting diagnosed, because an urgent embolism needs a treatment called thrombolysis, where you have to immediately inject a medicine to dissolve the clot. So be aware and stay safe. It's an important condition for all of us.